Hi guys, welcome back to my channel. I'm super excited about today's video because I have a special guest. Here with me today is my friend Claudia, and she is from the channel Claudia Glows, and I suspect a few of you probably know who she is. She has agreed to come and help me today because medical microneedling is something that I've wanted to do forever. I'm a big old chicken, and though I have watched all of her videos about it, I think I needed a little bit of moral support. So she is joining me today, and she's kind of walking me through and educating me and showing me how to do this. Now, I do need to do a general disclaimer. Apologies for this. The sound quality is not great, and even the video quality is suffering a bit. That's all Gary's fault. He's tech. I'm talent.
Thanks, Mary.
I just threw you under the bus. Okay, so I need to work out Zoom or some technology, and I'll get better at that, but I really enjoyed having her here. So let's check it out. So Claudia, I wanted to welcome you here to my channel. Thank you so much for coming today. This is so exciting.
Thank you so much for having me.
Fantastic. Now, you are here to help me because this is something that I have wanted to do for a very long time, but I've been a big old chicken. Now, I have watched all your videos, and it's one of those things that I think just because you and I have become friends and we've had opportunities to talk about this a fair amount, that the only way this was really going to happen is if I had some assistance. So you have been kind enough to come here and join us today to walk me through medical microneedling. I've talked about it a few times on the channel, and I did once do a microneedling video using a stamp, but it was a very localized sort of just working on just some scar tissue that I have from an accident very many years ago. But I really wanted to do this medical microneedling specifically for the collagen boosting properties. Now, I know that that's going to be all over my face, and there are a couple of different ways to go about this. There are different kinds of tools, but I have purchased the Dr. Pen at your suggestion after we had some chats about it, and that's what we're going to work with here today. So, friends, today we are going to go step by step, and Claudia is here to help us to do it, and I am scared to death.
Don't
get that on out there. So I've never done this before. The only thing I've done is charge up this device. I have a number of different needles here that we're going to use, and Claudia is kind enough to help educate us a bit on what it is and why we're doing it, and then she's going to help me actually do a demo. So Claudia, thank you, welcome. Hopefully you can just talk a little bit about microneedling, why we're doing it, and maybe the differences before we dive in.
Yes, of course. First of all, don't be scared. I told
Okay.
you
I know you keep saying that.
You will say afterwards, why did it take me so long? But I think it's important to say that I'm not a doctor. I'm not a dermatologist. I'm not an esthetician. I'm a PA by trade, and is something that I learned a long time ago, but it's been so long that I can't even use that anymore. But it has made me comfortable using needles. And microneedling is something I have done for about 12 years now.
A long time.
But I'm by no means an expert. I'm just sharing with you, what has worked for me. So I want to encourage your audience to please do their own research and really make sure that they're not just following something we tell them to do.
Of course.
So medical microneedling, there are different forms of microneedling. We're going to be medical microneedling. Medical microneedling is also known as collagen induction therapy because it does just that. It induces collagen. So the reason is when we medical microneedle, we use these tiny little needles. They start for medical microneedling at a needle length of 0.5 millimeters or longer. And at 0.5 millimeters, so if you picture your skin, right, you have your stratum corneum, the outer layer of the skin, then you have the epidermis and the dermis. So at 0.5 millimeters, you're kind of just starting to enter into the dermis. Mm-hmm. In the dermis, we have collagen fibers, elastin fibers, fibroblasts. So we are creating a controlled injury. Sounds scary, but think about it like working out, right? If you lift weights, you're basically breaking the muscle down so it gets stronger. So similar concept. We're creating this controlled injury. The body responds. It responds with a cascade of reactions, which eventually lead to more collagen and elastin production. So it produces more growth factors. It has this whole, like I said, cascade of reactions that it does. A few weeks from when we microneedled, it produces more collagen and elastin. So that's medical microneedling, which is what we're going to do. There's also cosmetic needling, which is at a shallow depth, 0.2 to 0.3 millimeters. So you're really just going into the epidermis. Mm-hmm. Some people say you get some collagen production. I'm skeptical because it doesn't go that deep. Mm. I think it's really more, personally, I think it's really more for product penetration. And, of course, you want all the layers of the skin to be healthy. So cosmetic needling has its place as well. And then there's nanoneedling, which really just gets the top surface, the stratum corneum.
Okay.
And that one doesn't even use needles. It's confusing. It's called nanoneedling. But rather than using tiny needles, it uses these tiny cones that basically just separate the stratum corneum slightly so product can penetrate deeper. So those are the 3 different forms of microneedling.
And you do all 3 of those yourself, don't you?
I do all 3. You know, I was gung-ho about nanoneedling for a while, and then I honestly gave up on it because it seems kind of tedious to me, and I don't know if it's really quite giving me the payoff.
You're getting the payoff?
Yeah.
Yeah. Okay.
So I cosmetic needle once a week, and I medical microneedle about every 4 to 6 weeks.
Okay.
That's really important.
And you use the same device for both? You used,
yeah.
Okay.
Yeah, you will use different cartridges. So the nice thing about the Dr. Pen, it comes with different cartridges. Exactly. It comes with a 36-pin cartridge and a 16-pin cartridge.
16. Yeah.
So
and which one am I using today then for my medical microneedling?
So for medical, so think about the less needles, the deeper the penetration, right?
Okay.
So if you think about, you know, like a mat with nails on it, you know, there's a ton of nails. That's why people can walk on them, because they're very closely together. But were there only 3 nails or something and you would walk on them, they would, of course,
they're going straight through. Okay. Exactly. So that tells me 16 is what I'm going with.
Exactly.
Got it. And we had talked about, I do have some scarring from an accident that I was in here. There's some on the nose. I don't even know if you can microneedle the nose or not. And then I have what I call my train tracks, which are lots of scar tissue that you had talked about. Maybe we go up to a 32 for that. We may today, we may not. I haven't decided yet. But at any rate, that's what you would use those for, is some of that tougher skin. Is that right?
No, actually, you would just go deeper. So 32 doesn't, so you got to think scar tissue is thick, right? You have some keloid scars that are thick.
Yeah, I do.
So obviously to penetrate those, you would have to go deeper. Using more needles wouldn't do it because they wouldn't penetrate deeper, right? So the more needles, so the 36-pin cartridge is for cosmetic needling.
Oh, thank you for clearing that up. Yeah. Okay. So I don't need the 32 today. That's to put away if I want to do cosmetic needling on another day. Okay. Well, I'm just going to put that over there. And we are going to focus on the 16. Okay. So should we go ahead and try to put this on? Yep. Maybe we should talk about how we prepare the skin first.
Yep.
And viewers, I have been walked through this today myself. So I have started with super, super duper clean skin. I did a double cleanse, but then I kind of did a triple, and that I used a cloth to make sure that everything is gone from the face, because essentially we are creating channels into our skin. We're creating holes, and anything that is around those holes could go into those holes, and we don't want to contaminate our skin with anything other than what we choose to put on it during this process. Is that right?
Exactly. Your skin looks amazing, by the way.
Thank you. I'm feeling a little red at the moment. Yeah, I don't know if it's the light, but anyway.
You get that healthy flush.
I think it's the fear.
That's okay.
That it's reacting on my skin. So what I have here in front of me, guys, is starting with super clean skin. I have a number of these little antibacterial wipes because it's critical that everything remains super clean, because again, open channels on the skin, we don't want anything to get inside, particularly to contaminate, bacteria, that sort of stuff. So I have a serum here. This one, Claudia made me buy it. This is from a recommendation of one of her videos. This is the Neo Recovery Cellular Repair Serum. And we are going to put this on before we do the microneedling, and we'll put it on as a repair after. Is that right?
Yeah. So you said you did great. You cleansed your skin really well. That's very, very important. Like you said, you don't want to needle anything into the skin that we don't want in there, any sunscreen, any makeup. Some people like to use alcohol to wipe their skin clean. Personally, I don't like that. I think alcohol and my skin just don't get along. But if you really wanted to be 100% sure that there is not any bacteria on your skin, that's an option. You want your hands to be very clean. Some people wear gloves. I think it's silly to wear gloves to work on yourself, because, as long as your hands are clean, that's all you need.
Yeah.
Because gloves obviously can get dirty as well. Now, as far as the serum, so when you medical microneedle, there are different ways to do it. And I have gotten to the point, and we'll show how to do that, where I use a stamping motion. So with a stamping motion, you really don't need anything on your skin. In the olden days, before I used the stamping motion, I will go in a circular motion.
I remember.
To do that, I needed some slip so that I wouldn't just scratch my skin. So for that, I would use high molecular weight hyaluronic acid. That's mostly for slip. But also high molecular weight hyaluronic acid is a bit anti-inflammatory. Since we are creating some inflammation, that can help. You don't need that. But what you can do, and that's where the stem cell serum comes in, since you are creating tiny channels, you have the opportunity to introduce something into the skin that you actually want there, that does something good, like stem cells. So you can apply that now, and then we're going to needle that in. But if somebody wants to do that, or if you want to do that, you have to really make sure that what you're applying before is safe to be used for medical microneedling. So don't use any coconut oil or something crazy, something that has a bunch of preservatives or something that we wouldn't want to introduce into the dermis. So it really has to say on there, or has to be approved for medical microneedling or for mesotherapy, which is injections. Now, if you can inject it, obviously you can medical microneedle it.
Sure.
So you have to really make sure, if you're using a product, that it is something that's safe for you. Now, with cosmetic needling, it's a whole other ballpark. We don't have to worry so much about it, but with medical microneedling, we have to really make sure that what we're putting on the skin before, during, after is really something that is approved for medical microneedling.
Okay. So I happen to have this serum here anyway, which is great, because I didn't know about the putting on beforehand, because I do know you did a video recently that you used to do it in round motions, but it's quite possible there's a little bit of drag associated with that, which is why you feel the stamping is a bit more effective. Is that right?
Yeah, I used a different device before the Dr. Pen. I no longer use that device for, there's a whole
variety of reasons.
whole story behind that one. Yeah, but I no longer use that device. But I did some testing with that device and the Dr. Pen, and both of them, using them in circular motions, was okay. In a drag-in motion was definitely not okay. So you see a lot of people on YouTube taking their device. So this, I don't have the Dr. Pen right now, but they go like this.
Yeah.
And I think you saw the video. I used it on a banana, and it scratched the banana. So I think circular motion is okay, but to me, the safest seems to be logically seems to be just doing a stamping motion. So yes, in the past I used to do circular motions, but I also used a different device. But even with that device now, were I still to use that, I would stamp now, just because of that experience that I did. It just seems a bit safer. And I also, having done the stamping motion now for my last 3 treatments, I feel I get a better treatment. I have to admit it's a bit more uncomfortable. I hate to tell you that, but you don't know because you haven't done the stamping motion or the circular motion. It is a tiny bit more uncomfortable, but I do feel that it is more effective, honestly.
Okay. Okay. And it's going to take longer, I imagine.
It's going to take longer. You think about if you're doing circular motions with a glide, that's going to be much faster than stamping every tiny little inch of your skin. But that's okay. It's something we do every 4 to 6 weeks. It's something you're going to see tremendous benefit from. So I think it's worth taking an extra few minutes and doing it right.
Okay. That's what we'll do then. Okay, so I have my pen. I have fully charged it. This is also does not require a plug-in, but it can be plugged in. If I'm fully charged, am I best to just unplug it for ease right now?
Yeah, you can unplug it for ease. Yeah, I mean, I think you're fine.
Okay, and now I'm going to open up my cartridge and I'm going to assemble this into the pen.
So it should have a little flap at the top where you just separate it and take it. Oh, you got it out already. Okay.
Okay.
So now you just.
And then.
So leave that plastic cap on still and just screw the skinny part into the pen.
Into the pen like this.
Exactly. And it should screw in with a couple of clicks. It needs to really sit in there securely. So try to pull on it and it shouldn't pull off anymore.
Okay, so it doesn't like twist a whole bunch of times. It just twists.
No, just a couple of times. So you still have that plastic cap on there.
Yeah.
So once you take that off, the needles are exposed. So you have 16 needles in that cartridge.
Okay.
Now the Dr. Pen has a dial, and you might need your glasses for that one because the M8 is really hard to read. So you might want to put your glasses on just to dial it in at I think we decided to go to 0.5 millimeters.
We did.
Dial in the depth first. So do you see the little silver dial? It's really hard to see.
There's a little silver dial right here.
Exactly.
Yeah. Okay.
So you put it on 0.5.
Oh, I see. It does have the numbers on it. Okay. It's default to 0.5. Perfect. So it's on the right.
Okay, good. Okay. So because you could, if you decided you want to go 2 millimeters, which would be crazy, but you can dial that to 2 millimeters.
Oh yeah, it does.
Or you can go less. So this is where you dial in the depth.
Okay, so we're going to start on a 0.5, which is kind of the lowest level for medical, right?
Exactly.
Okay.
Like I said, you're just beginning to enter the dermis there, depending on how thick your skin is too. I have quite thin skin, so for me, I'm probably definitely entering into the dermis. 0.5 is a great way to start, I think.
Okay.
And you really don't need to go deeper than that if you don't want to. You hit that button to turn it on.
And then there are going to be numbers.
Exactly. And that's the speed. So that's the RPM. So 1 is pretty slow. So I like to go at the highest speed. So it goes up to 6. I like to go between a 5 and a 6.
And where should a beginner start?
You know, it's interesting because with the stamping, to be honest, I haven't quite figured out if the speed makes that much of a difference, because you are just holding it there for a couple of seconds. So higher speed probably stamps in a couple of times. I would say go at a medium speed, maybe go to 4 or 5. It doesn't make a difference as far as discomfort.
Does it not?
Mm-mm.
But it's how many times it's hitting the skin. Is that what it is?
Exactly, exactly. So if I was going in a circular motion, I would want the highest speed. But again, with the stamping, I haven't quite figured out how much does the speed make a difference. You know, how many times as I'm holding it there for a second, does it actually go in there? So maybe go to medium speed. Go to 4.
Okay, and then I'm just going to hold before I actually apply it. Am I just going to take a section and I'm just going to hold it there for a second?
Exactly.
Or what am I bouncing it like around?
So you're going to take it. So if this was my doctor pen, right?
Yep.
So I like to sort of section my face. So this is one section, right? Other section, forehead, and then around the mouth and the chin is another one.
Yep.
Personally, I don't microneedle my nose. You can microneedle your nose. When I do, I always break out on my nose for some reason. So I just don't do it, but you definitely can. So I like to start at the jawline. And so you put it just a second, you set it right next to it, a second, and you just keep going. So it is a bit tedious because the surface area is about as big as this pen.
Yeah. Okay.
But again, I think it is worthwhile to take your time and do that. Now, what I like to do is I like to go horizontally, and then I like to also cover the area vertically, just to make sure we cover everything. You will see if there is any area missing, because you will get erythema, redness. So if you have an area missing, it will be white, but we'll get to that. I can see you freaking out.
Is my face giving it all away?
You have erythema already.
I do. Yeah. Okay. Okay, then. So I think the first thing is to apply, we're going to start on this cheek, I suppose, and just to apply some of my serum on it first.
Exactly. So I would like you to just clean your hands off again. Yeah. And then you can apply the recovery serum all over the face. All over. Because we don't need the slip, so it doesn't matter if it actually dries out.
Oh yeah, we're just going to have that nice, little bit of stuff there.
We're introducing some stem cells or some growth factors into the skin. So that'll help with recovery, that'll help with collagen boosting and all of that. That is not necessary, by the way. You don't have to do that. You could just, again, with the stamping motion, you could just do it on a dry skin without anything.
But you might as well.
Since you have that serum, you might as well use it and take advantage of it.
And are you doing the eyes at all?
Yes, we're going to go under the eyes as well.
And do you do up here?
Yeah, I actually like to do my eyebrows, because it can help a little bit with hair growth.
Okay, great.
And I'm sure you overplucked your eyebrows just like me in the 90s. So,
my problem is different. I don't grow hair in certain parts of my eyebrows from a car accident, that same accident. It's very odd. So I have some challenged hair growth situations there too. Okay, so all of that is clean again.
But you and I talked about that. I had a big scar on my face. It's different than yours. It wasn't a keloid scar, but it was a scar, and it was very visible. It was actually the whole bottom part of my face, because I fell off my bicycle, and it is completely gone. So medical microneedling can do wonders. Now, I can't promise you that we can get completely rid of the scar, but it can definitely improve it.
So do I take this thing off?
Now you take it off.
Okay. And I wonder if you can see into.
Yep, you can see it. So you can see the cartridge. So it doesn't matter what depth you go, right? It's always the same cartridge. So if you were to decide right now, I want to go 2 millimeters, which again was crazy on your face, but let's say on your body, you would still use the same cartridge, but you would just dial it up to 2.
Okay.
And then they come out for 2 millimeters. So right now they only come out for 0.5 millimeters, which is barely visible.
Which is exactly what I told it to do, but double checking. Okay, so now we're going to dig in. Oh dear. So am I holding my...
So you don't necessarily have to hold your skin taut. When you use a derma roller, you have to hold it taut because there is some drag. With the pen, you don't necessarily have to do it. If you feel better about holding it taut, I mean, you're
not really.
Your skin isn't that loose, so you don't really have to do that. So decide where you want to start. Do you want to start up on the ear? Do you want to start down here? Let's start down here. So let's start down here. So I'm going to do it with you with my pen here. So we're going to start down here.
Okay.
And you're going to turn, is it turned on?
It's turned on.
Okay. So just put it there for 1 second. You can do it. Take a breath. Deep breath. You can do it. You got to touch it. There you go.
Oh, I did. Okay.
Then you're setting it next to it. Give it just an extra second. So just touch it. Give it like just a second. There you go.
Oh, right. Okay.
There you go. Good. Good. Do you feel the needles going in?
I do.
Is it
not as bad as I thought it was going to be?
I told you.
You did.
And the thing is,
comfortable, but it's not. It's not bad.
But once you keep going, you get kind of used to it, and then it really doesn't feel that bad anymore. And there are certain places on the face where it's more painful than others.
Like we talked about that, like the forehead, which is where I have a lot of scarring.
Around the lips is a little bit more painful too.
Oh, that's so interesting. No, it doesn't hurt.
Good.
It's gonna take a long time though.
That's okay. That's okay.
So I go up now, one.
So now think about, you just created sort of this line, right? So you're going to set it right up. So you don't want to overlap, but if this is the line you created,
close by
right next to it. Exactly. So we don't really want to miss a spot, but we also don't want to overtreat. But again, we're also going to go vertically. So if there is anything you're missing, we're going to get it that way.
Well, what's handy is it makes a little bit of a circular mark so you can sort of see.
So tell us what it feels like.
It's just a little prickly, but it's not as uncomfortable as I thought. I was absolutely terrified to put this on my skin. I think you could see that. I think you could see that.
I mean, it is a crazy thought. You're poking needles into your skin. It is kind of a crazy thought. But
well, I do have a tattoo, but I've sort of done that before.
It's just.
But I found that hurt.
Yeah.
And just keep going up, right? So now I'm about here, I think.
Exactly. And yeah, you can see that definitely takes longer, as if you were going to do lines, but I would really discourage anybody from doing lines. I mean, I did that experiment on a banana, and obviously banana skin is not the same as human skin, but why risk it? It would make sense that you can create some little grooves because the needles just sort of scratch along the surface.
Now, are there other areas that you can do besides your face with microneedling?
You can do your whole body.
Like your hands, or?
You can do your hands, you can do your scalp, you can do, I mean, you and I are doing the scalp with the Calecim recovery serum.
Yep.
So you can do the scalp, you can do your body. I have a friend who does a whole body, which I think is a little bit crazy, but
really,
whatever floats your boat. Definitely, I would say, if you're doing the face, also doing the neck and the chest, because what I did for about a decade is I just did my face, and I got great improvement on the skin of my face and my neck and my chest.
And it didn't match.
It did really neglect, and they still don't match. They're still quite neglected because I just haven't caught up, even though I do the neck and chest now. So
I'm just going to keep going up, yeah?
Exactly. Don't go past the ocular bone. So you know where your ocular bone is right here? Don't go past that. We'll do that one separately.
Okay.
So the skin under the eyes is obviously quite thin. We're going to dial down the depth a little bit for under the eyes.
Okay.
So you want to always make sure you don't go past that bone right here where you don't become hollow, so the ocular bone. But yeah, I would definitely suggest, if you're doing this, also do your neck and your chest.
Okay. I probably won't do that today.
And that's fine. You can do it on the day after.
Other day.
Yeah, exactly.
Ooh, a bit more sensitive there.
Well, because there's bone there, right? So you got to think where our cheekbones are. It's sort of the same sensation.
So I'm not going in here. I'm stopping now, am I?
Yeah, you can go a little bit closer by the nose here, but just make sure that you're not going too close under your eyes. So I see that you have just a little bit of white here still.
Yep.
Yeah, so you can go there. Exactly, just not too close.
I kind of want to do my nose. I haven't done my mouth though.
Yeah, we do that separately. So like I said, I like to do sections. So we'll good. So you see you have a little bit, it's a bit hard to see because you have some pink cheek on the other side too, but you definitely.
Yeah, but there's a lot of redness. Yeah.
Exactly. So now we'll do the same thing vertically. So start at your temple and you're just going to go down.
No, I didn't do this part here. Should I have done that?
We can include that with we can include that with the forehead.
Okay, so just start here then. Okay.
Yeah. Just start, and like you said, on the cheekbone there, it is a bit more painful. I sometimes bruise on the cheekbone because I don't have any fat there. It's just bone. So that can.
So what do you do there, you said?
I sometimes bruise there because the machine just sort of hits the bone. Yeah. But yeah, there are definitely certain areas of the face that are more sensitive than the others. I find right here is the least sensitive.
I'm finding some sensitivities here, but my skin's a bit red right now, so it just could be responding differently. Do you know? Mm-hmm. Like it just could be a little red today.
But is it as bad as you thought it would be?
No, it's not. You're like, I told you so. I told you so.
And again, the reason we're doing this, it seems a bit crazy because we know that inflammation causes aging, right? So it seems a bit crazy to create an injury and create inflammation on purpose. But inflammation also causes the body to react, right? We just don't want to cause too much inflammation. So it's really similar to working out. When we're working out, we're causing inflammation as well.
I was going to say that was a good analogy because you're kind of tearing the muscle in order to build the muscle up.
Yeah.
Okay, so I've gone up and down now as well.
Did you cover the whole thing?
I
Seems
thought I did,
like
but
you
now
went
you
a
make me
little
think I
fast.
didn't. I know. Maybe I'm going faster. I don't know. Well, now I don't know. I just ended up here.
Okay. Did you go all the way to your nose?
No.
Okay. So think of that whole section, your cheek, with that little cutout of the mouth. But just think of that whole section, and you can go down by your what are these called? I always forget the name. The nasal labial folds. So go all the way down this way, and then we'll do the rest of the mouth and the chin separately.
I'm going to do the nose though, because I have a lot of scarring in my nose.
Okay.
I'm sensitive though. About the bone.
Mm-hmm. In certain areas, you find yourself probably wanting to sneeze too, like the forehead.
I remember you saying that in a few of the videos. Yeah. Okay. So what am I doing now?
So if you want to do the nose, I would say do the nose right. Really cover the whole area. So make sure that you're covering all of it, not just like one line. Now we'll do the same thing on the other side. So
okay. This is actually probably going to be easier to see, frankly, video-wise.
Uh-huh.
So I'm not doing the chin yet.
Not doing the chin yet.
Kind of down here. Okay. So
Exactly.
we'll start down here.
So start at the jawline.
And how long did it take you to start doing it on your neck?
I would say I started on my neck probably about 2 years ago. So I wish I would have done it. I completely ignored my neck for the longest time, as if it just wasn't part of me, So I didn't put any skincare on it, no sunscreen, nothing. And now I look in the mirror and go, okay, I can definitely see the difference.
Now I'm going to go up and down.
Exactly. So really make sure that you're covering as much as you can. So see it like I'm seeing right now, you really could take about this much in between. Yeah. So think about where that little dot is, right? So you're going to put the little dot and then you put it right next to it. So don't put a dot and then go an inch down from it. Because we really want to, I know you want to get it over with.
Should I think about over that again or no?
You only did about 3 passes there, so you can go, three dots, so you can go over it again. Yeah, because you really kind of skipped a lot of skin there. So that's why I like to really go in a line, horizontal, 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 and then vertical to make sure that I don't miss anything. Yeah.
Okay. They go from the top now?
Exactly. So be aware that that's more sensitive, the top. Okay. But that's also what most of us really want to work on. Exactly. The upper lips is not something I look forward to.
I'm doing it.
Okay.
Yeah, that's hurts.
Yeah, I'm sorry. I know the upper lip is horrible. I don't like it either. It usually gives me some tears. Not so much look like I'm crying, but it just makes my eyes water.
Yeah, it's making my lips shake. Ouch. So now we're going to do the eyes or this forehead?
Let's do the forehead because for the eyes, we're going to dial it down. So we're going to do the forehead. So the forehead is uncomfortable because there's really nothing there. There's just skin and bone.
Now it does a little bit more sensitive up here now, I have to say.
Mm-hmm. You're almost there.
Yeah.
You're doing really awesome. You will feel tight. So this causes some, epidermal water loss. So for a couple of days, you will feel really tight. Your skin will feel really tight. You might even get a tiny bit of shedding. That's okay. That's completely normal. So you will be tempted to put things on. So just keep putting on the stem cell serum if you have, but we talked about this, you don't have high molecular weight hyaluronic acid. That would be something you can put on.
Okay. We're getting towards the end, are we?
Okay, we're getting towards the end. Again, the skin under the eyes is quite thin. We don't want to go that deep.
Okay, so I'm going to 0.25, correct?
Mm-hmm, exactly.
Okay.
So under the eyes, again, we have to be really careful. So you really don't want to go past the ocular bone. The ocular bone is this bone right here, and then it becomes hollow, right? But obviously, we want to get close to the lash line because we want to work on those fine lines. So what I do is, what I want you to do is actually take an alcohol pad and just make sure your fingers are clean, just to be on the safe side. And the reason we're doing that is because you are going to touch your skin now. Again, you have these open channels. We just, in case there's any bacteria made its way onto your fingers, we're making sure. Okay, so you're going to take these 2 fingers, very gently place them on each corner of the eye, and then very gently just think about pulling that eye skin down just a little bit closer to
down.
Exactly. Towards the ocular bone. So you're also going to hold it taut between those 2 fingers, right? And pull it down. And so now you can go to that all the way up to the ocular bone. And that allows you, because you're pulling that just slightly down, it allows you to just get closer to the lash line.
So is that looking about right?
Yeah, you look good.
It feels agitated, you know, it feels sensitive. It feels like it's had a workout. It doesn't hurt, but it's it's uncomfortable, but not massively. Do you know what I mean? It just feels interfered with, which I guess is a way of putting it, you know?
LED is a perfect treatment to do after this.
Oh, I meant to ask you that. That was important. No, I've heard that. However, I mean, can you put a mask on? I don't have a panel.
You can put a mask on, make sure to really sterilize it.
Yeah.
So really wipe it down with alcohol, let it dry really well so that you don't get the alcohol onto your skin.
Yeah.
And then, yes, you can definitely do it. How does it feel on the neck?
It's fine.
Isn't that weird? I feel the neck is much less painful.
Yeah, it's weird. I would have thought it to be thin.
I mean, if you ask me what has made the biggest difference in my skin, well, three things, probably sunscreen for sure.
100%.
Tretinoin, and then microneedling. Did you do this area as well?
I did not do this area. I did.
Okay.
I kind of stopped about there. I haven't done straight down.
Yeah, like I said.
Can I do more of it?
You have a bit of white here. Let's keep the thyroid.
Well, let's do it, because the neck is an area that I would like to see.
Yeah, go make sure that you get, even erythema everywhere.
Okay, yeah. So I'm done.
You're done.
I'm done.
So now, if I have pinpoint bleeding, I wash it off so I don't scare my husband. But you don't have any pinpoint bleeding. No. So really what you can do is you can just put more of the serum on now. Again, I would wipe your fingers off really well.
My fingers. I'm opening up a clean one again.
And just apply, really let it sink in, because right now you have those open channels. So to get those stem factors in there,
get the good stuff in there.
We really have to stress it needs to be something that is safe to be used for medical microneedling.
Okay.
So don't just, I get people ask me all the time, can I use this oil? Can I use this oil? No. Okay. I mean, could you? Probably, but do you want to? Probably not.
Do you want to take the chance?
Exactly.
Oh, it feels nice and cooling on the skin.
Because once you have granulomas, again, granulomas are these foreign body reactions under the skin where the body just takes a foreign body and puts a capsule around it to protect the rest of the skin. What do you do then? How do you get that out? So why risk it?
I did it. I'm nice and red. Yeah. What do you do with the cartridge?
You dispose it. You throw it away.
You throw it away. Now that's great. That is great. There's no sterilization. You just take it out and throw it out.
Some people say they sterilize it. I don't know. They're so cheap. I think better safe than sorry.
I mean, that's sort of the benefit to this system is cartridges that you throw away, right?
Exactly. And it's not that much waste. It's a tiny bit of plastic. It's not that much waste. So I throw mine out.
Definitely. Okay, so I throw it out, put it away, and wait until I do the next one. So this is what my skin is looking like.
Looks good.
It is nice and irritated, but there's no bleeding. I thought there might be bleeding, so it's nice to see that didn't happen. Claudia, thank you. Thank you so much for coming on today to do this with me, because it's been that little thing, that you really want to do, but it's like people who don't want to go on roller coasters. It's like you kind of want the thrill, but you don't actually want to go and sit down in the chair and put the little bar down, and that's what it's been like. So now the fear is gone. At least I know what to expect. And I know that, yourself and so many people talk about the benefits of this. And this is only going to go one way, which is into my regular routine. I will do this every 4 to 6 weeks. I will probably take some photos for the sake of this video, just to see how it does, in a couple of hours time, and maybe tomorrow morning. So I'm just going to just apply this maybe every couple of hours if I'm getting a little bit of dry, and then I might try, and then I might also put the Calecim on tonight, the multi recovery cream, I think it's called.
Well, so they have a gel, they have a nighttime moisturizer. I have it in the bathroom. It's sort of a jelly, pink jelly.
I have two. One's in a tall pump, and one's a jar.
Okay, so you don't have the one. They have a post-procedure one. That's sort of an overnight mask. That one I thought you have. No,
I don't have that.
Then I would say stick with that, or stick with the low pink serum.
Okay, I'll just put the other Calecim on. Okay.
Yeah, tomorrow you can do the other stuff, but still, for a few days, stay away from acids. No vitamin C.
I would.
No alpha-hydroxy acids. None of that. Retin-A, all of that, and then in about 3 days, you can introduce all of that again.
Okay. Well, you guys, I did it. I
did
medical microneedling. I'm like, good job. Yeah. So all because of you. So thank you for turning me on to that. Thank you for showing me how to do it. I really appreciate your time and you joining me on my channel. Hopefully this is one of many, because I enjoy you. I think you're great. And I think my guys are going to like you too.
Me too, likewise.
So
thank you so much,
you guys. obviously have to check her out. She's Claudia Glows, and I will put the details down below of where you can find her, although you probably already know her. So there you go.
Thank you for trusting me with this.
Of course. Oh yeah. No, I'm feeling good now. I'm feeling good. I'm going to now go and do my LED mask for my face and my chest and just kick back a little bit. Maybe go watch a movie, something indoors. I know that.
Good.
All right. Claudia, thank you so much. We'll see you soon.
Thank you. Bye.
Bye.
I don't, companies just send it to me. They don't. I just order it myself.
And that's exactly the conversation that Gary and I had. Oh, it's very funny.